not there.
Good afternoon, everyone. I am Ubaidur Rahman. I am going to talk about the use of a digital otoscope as a nasal endoscopy device and as a pedagogy instrument. I have no financial disclosures. So irrespective of whether you do an external DCR or an endoscopic DCR, nasal endoscopy is very relevant because preoperatively it can help you in delineating the nasal anatomy, identifying anatomical variants and pathologies, and post-operatively you can assess the ostium size, ostium function, and complications. But usually oculoplastic surgeons do not perform any sort of endoscopy because of two main reasons. The first being lack of access to expensive instrumentation, and the second one being lack of knowledge and training for nasal endoscopy. So through this study, we tried to address both of these things. So we used a digital otoscope. This is made by a US-made company, and it is sold as an otoscope. You can see it is a very small device, fits in a single hand, and has a 4.5-inch high definition screen. It has a probe connector which is 3.9 millimeter in diameter. It has 6 LED lights for illumination. And when connected to the device, you can see it captures images and videos in excellent resolution within a working distance of 20 millimeters and can be charged easily with a mobile charger. So preoperatively, these are the major structures that were taught, and the DNB students and oculoplastic fellows were trained to identify these 6 major structures. So this is how preoperative endoscopy was done with this device. You can see this is the middle turbinate, inferior turbinate below, and you can go along the floor and you can easily see the nasopharynx also. So this is intraoperative use of the device. You can see the ostium from the nasal side. This is the internal opening from where you can see the fluorescein dye. Then intraoperatively, this is how the ostium looks from the nasal side. This is the created ostium, and you can see the probe coming out. This device was also used for endoscopic probing in children. This is the inferior turbinate, and in the inferior meatus, you can see the probe coming out and hitting the floor of the nose. Then post-operatively, this device was used for retracted tube removal. So these patients were not sent to ENT department. This is a silicone stent you can see lying over the middle turbinate. And forceps was introduced, and under direct visualization, this tube was removed. This is patent syringing in the same patient after tube removal. Then post-operatively, you can assess your ostium. This is a 1-month large ostium. You can see a beautiful large ostium here. Then another 1-month ostium with, this is the fluorescein dye coming out. And a round 6-month ostium can be seen in the third video. Then post-operatively, you can assess your complications. This is anterior synecdoche formation in the first image and a granuloma formation along the tube in the second image. So this device was used to train and teach 13 trainees, which included oculoplasty fellows and DNB residents. So they performed individually 10 preoperative and postoperative endoscopies after the training. Preoperatively, 46% had never in their life observed nasal endoscopy before, and 84% could not identify more than one structure. But after training, this improved to 76.9% could identify all of the structures, while 23 could partially identify some of the structures. And subjectively, 84.6% felt that endoscopic teaching enhanced their overall understanding about lacrimal drainage system and DCR ostium. So this is just a comparison between the device and the conventional nasal endoscope. It is easy to use, a very short learning curve, portable, can be carried in your pocket. There is no need of any additional equipment. It is very cost effective, although the image quality and working distance is less than a conventional endoscope. So to conclude, low cost, handy utilitarian devices can be helpful in resource limited settings and peripheral centers. It is easy to use, portable, very good for documentation and teaching, and the images can be easily transferred and shared. Thank you.
We
It's
have, I
really,
think we
really
have a
nice.
lot of endoscopes with this machines, and we have Wi-Fi connections and other also, like real-time sharing. So that I think Amazon does have a lot of
Yeah, but so
endoscopes.
this particular device is not available in India, but it can be bought on eBay or
Yes, yes. So
So,
AliExpress. This is a device, ma'am, originally an otoscope for ear wax removal.
yes,
yeah.
But since the probe is very thin, the quality is very good. So we tried to use it as an endoscope,
So
and we
that
had
comes
very
with
good
the probe
results.
also,
Yes,
probe
ma'am.
and the phone.
Yes, ma'am.
Both.
And it is very cheap. It is around 7,000, 8,000.
Okay. In your study, in which cases was it used? DCR or
In all
probing?
external DCRs and endoscopic probing in children.
Just to have a good anatomical location pre-operatively,
Yes,
it
sir.
will be very helpful because you can rule out all nasal pathologies
Yes, sir.
Good, good.
with
Thank you.
documentation. Thank you.